The webinar is now ready to begin. Hello, and thank you for joining today's webinar. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CNE session, participants are required to attend the webcast and complete the evaluation form, which will be emailed to the attendees following the webcast. Certificates will be emailed to attendees. This webinar is being recorded and will be available via the Sigma repository within 10 business days of recording. Following the presentation, we will have time for questions and answers. On your GoToWebinar control panel, you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenters. Be sure to hit send so that the message makes it to us. As a test, please submit your country in the questions feature now. Now I'll turn it over to the presenters and the moderator for our presentation. Dr. Teddy Potter, moderator.
Welcome. I'm very happy that you all have been able to join us today. I am a coordinator of the Doctor of Nursing Practice in Health Innovation and Leadership at the University of Minnesota School of Nursing. I'm also the newly appointed Director of Planetary Health for the school. I serve on the consulting committee of Columbia's Global Consortium on Climate and Health Education, and I'm chair of Clinicians for Planetary Health for the Planetary Health Alliance at Harvard. We would like to thank Sigma Theta Tau International and the Alliance of Nurses for Healthy Environments for today's collaborative webinar offering. We would also like to thank our speakers for sharing their expertise with us this afternoon. With us today are Dr. Ruth McDermott Levy, an associate professor and director of the Center for Global and Public Health at Villanova University. Her area of expertise is public health nursing, focused on global and environmental health. She was an editor of the American Journal of Nursing awarded Book of the Year, Environmental Health in Nursing. Ruth has conducted research in Pennsylvania's fracking communities and published about including environmental health and climate change in the nursing curriculum. In January 2019, Ruth returned from Finland as a Fulbright scholar, where she examined nurses' observed health impacts of climate change. She also worked with Finnish nurses to link climate change to health and address mitigation and adaptation strategies. Our second speaker is Dr. Lisa Thompson. Dr. Thompson is an associate professor in the School of Nursing at Emory University. Her research focuses on environmental health disparities that contribute to adverse perinatal outcomes. Her unique contribution to nursing research and education is in global environmental health, specifically developing interventions to reduce exposures to household air pollution from cooking fires in low-resource countries. She is co-investigator of a HAPIN trial, the largest multi-country trial to date on household air pollution. The third speaker is Dr. Dorian Camacho Rodriguez, Dean and Faculty of the School of Nursing at Cooperative University of Columbia and Vice President of ACO FAEN Board of Directors. She's an active member of ANHE, the Alliance of Nurses for Healthy Environments, and Sigma Theta Tau International and Honor Society. We are so excited to have all of you with us today. Now let's get started with today's presentations. Before we begin with our three esteemed speakers, I wanted to list the health impacts of climate change and our environmental degradation. I am sure that most of us are familiar with these broad impacts, but it's always good to link them back to health, so there's the understanding that even though these are serious for the planet, they're especially serious for the health of vulnerable populations. This caring for the environment and caring for the health of individuals related to health impacts of the environment is not new. As a matter of fact, it's deeply embedded in the Nursing Code of Ethics. In the 2015 Code of Ethics, Principle 9.4 makes it loud and clear that nurses need to be advocating for policies, programs, and practices within the healthcare environment that maintain, sustain, and repair the natural world. This is not an add-on task for nursing. This is part and parcel of our deep core of ethics. Next slide, please. I want to briefly discuss an initiative that is launching in April, and that is Nurses Drawdown, a group of leaders from the Sigma Theta Tau, the International Council of Nurses, the American Academy of Nurses, American Nurses Association, and ANHE have gathered together to collaborate with Project Drawdown to apply science-based solutions that will improve human health and have the co-benefit of improving the health of the planet. Next slide, please. As the most trusted health profession in the United States and our most numerous group of health professionals, we are advocating for 5 different areas of intervention. We are supporting food interventions, which include plant-based diet, use of clean cook stoves, and reduced food waste. Next slide, please. We're also encouraging people to get out and get moving by improving our bike infrastructure, walkable cities, and using mass transit as much as possible. Next slide, please. Our third initiative is gender equity in education. We're supporting the education of girls and also family planning. As a matter of fact, according to Project Drawdown Science, if we do these 2 acts together, it becomes the #1 most effective solution to drawing down greenhouse gases. Next slide, please. We're also advocating for nature-based solutions, planting trees, protecting tropical forests, and protecting our forests. And the 5th intervention that we have just added, but we feel very strongly about, is the field of energy. We're going to be advocating for clean energy and making sure that our buildings are as efficient as possible. All of these solutions are deeply based in nursing science. We know that humans' health improve with good food, mobility, social support, education, and exposure to nature. Now we're just tying it as well to the health of the planet. And why now? Next slide, please. This is a big year for nurses. It's the 2020 year of the nurse and midwife. It's the 50th birthday or celebration of Earth Day, and on May 12th, it's celebration of Florence Nightingale's 200th birthday. So the time is now for nurses to demonstrate that we are willing to take a lead on these very, very challenging environmental issues that threaten the health of all humanity. And now we are going to hear from some amazing nursing leaders that are doing just that, leading change. We'll begin with Dr. Levy. Next slide, please.
Thank you, Teddy. I know that the theme is exemplars of nursing leadership, but I'm going to flip this a bit and make us talk about how we can all be leaders. Before I do that, I want to place this in context and share kind of historically where we've been in the last 5 years of what is happening both in the United States and internationally that can support nursing education. Next slide, please. The Obama administration hosted a White House roundtable where the schools of nursing, medicine, and public health were invited to address the health impacts of climate change, to assure that we have a prepared healthcare workforce for the coming impacts of those that that slide that Teddy showed earlier, of all the things that are going to happen and are happening to both the planet and the people that inhabit the planet. So deans of schools of nursing from Emory, University of Maryland, University of Pennsylvania, NYU, Washington State, and Johns Hopkins represented nursing education at this White House roundtable. Next slide, please. Also in 2015 is the Paris Agreement that I'm sure many of you have heard about, and it was drafted in 2015, signed in April of 2016, and there are features of that relate to nursing education. The Paris Agreement talked about certainly reducing greenhouse gases, but also the importance of capacity building in developed and developing nations, and addressing climate adaptation and climate resilience. And these are things that nurses need to play a part in. Next slide. On the 25th of September in 2015, so 2015 was a busy year, 193 countries of the UN General Assembly adopted the Sustainable Development Goals. And of these 17 goals, they provide a blueprint to achieve a better and more sustainable future for all. And arguably, each one of these goals has a relationship to health. But goal 13 is climate action. And again, these are overarching United Nations goals that I hope you're talking about within your curriculum. Next slide, please. Also, in 2015, the American Nurses Association published the 3rd edition of the Scope and Standards of Practice for Nursing. And this was the 2nd time that the Scope and Standards included an environmental standard. The 2nd edition did as well. But in this edition, the standard talked about nursing actions related to workplace and community environments and nurses' role in addressing those issues. But it's important to note there was not any mention specifically to climate in that edition. So we're hoping in the 4th edition that climate is specifically acknowledged. Next slide. So in 2018, in October 2018, the IPCC, which is the Intergovernmental Panel of Climate Change, this is the world's climate scientists, the leaders in climate science, come together and really look at what are the issues that are impacting climate change. And they issued this special report that was quite sobering. And before this report, we had always said we can only get to 2 degrees centigrade. Well, the climate scientists got together and said, well, actually, if we get to 1.5 degrees centigrade above the pre-industrial levels, we actually are going to notice impacts as well. And those impacts include the health on human beings and then thus affect nursing practice. Next slide, please. That following November, so a month later, ICN released their revised position statement for nurses, climate, and health. And this statement was much stronger than the previous statement that said that it is unequivocal that climate change is causing human health problems and that nurses need to be prepared to address those problems. And so that happens, the way we prepare that is through nursing education. Next slide. So at the same time, so if you can imagine, the fall of 2018 for somebody doing climate change work was quite busy. The United States released its 4th National Climate Assessment, and this provided more evidence of the impact of climate change on human health. Just so you know that this assessment is mandated by Congress every 2 years. So one is due out at the end of this year, and these are great resources for teaching about climate change. Next slide, please. So now we're going to take that and transition then into what nursing education is doing in the United States related to climate change. Next slide. So we have, in the US, we have our accrediting bodies, the National League for Nursing and American Association of Colleges of Nursing, and both of them have statements that are related to environmental health and nursing education. The NLN's most recent is 2010, so we would expect that that would be revised soon, but that says that nurses at all levels of nursing education need to address environmental health, and it includes, it does not include, though, the effects of climate change. It says that we need to be able to assess the climate, assess environmental issues, and respond accordingly. AACN has similar statements in their essentials. They, in both the baccalaureate and master's essentials, it says environmental health is discussed. Well, environmental health is discussed, and nurses need to be prepared to, again, assess and respond to environmental risks through health history and identifying personal and workplace exposures. And we have a role in emergency preparedness and disaster. But again, and it also adds that we need to have a global perspective, but it doesn't specifically say climate change. And so as these revisions are taking place, we really need to say climate change as well, because it is very different than looking at workplace exposures or occupational exposures or even personal exposures. The DNP essentials, if you look, they were published in 2016, so almost 14 years ago. So we weren't as advanced in thinking about climate change as we were in the last 5 years, certainly. But there are features in the DNP essentials that specifically the essential for clinical prevention and population health that look at analyzing biostatistical, epidemiological, and environmental data that could be focused again on looking at environmental things and climate change, but it does not specifically say climate change, and they really need to. Now, although the Future of Nursing report is not a accrediting body, our curriculum committees and our schools of nursing do look at the future of nursing as a guide of what else should we be considering. And in the 2010, the most recent one is 2010, they do talk about a global perspective for nursing and nurses' role in policy. There is a new Future of Nursing expected to come out, Future of Nursing 2020 to 2030, and they are looking at the impacts of practice, but they're not specifically stating climate change, but they are making recommendations about how, nurses' role in leadership, again, a lot like the previous one, and how the social determinants influence health, and how we can help build and sustain a culture of health. And so we're going to talk about this a little bit further on when we think about how we can all be nurse leaders in this. Next slide, please. So there are many opportunities for nursing education to incorporate climate change into the curricula. Here's a very brief list. One of the things that's missing from this list would be foundations or fundamentals of nursing, where we can start with our entry-level nursing students and talking about where the products they use come from and where's the eventual disposition of those products, and thinking about becoming more sustainable in our nursing practice. But also thinking about the health and illness of people and the pathophysiology of disease processes, and how particular patient populations would be influenced by our changing climate, whether it be heat waves, whether it be wildfires, or any other extreme weather event that we have been experiencing lately. Also thinking about in our pharmacology courses, are there certain medications that people don't tolerate well in extreme heat? How medications may be needed to be stored, because if our houses are warmer, we may not be able to leave medications out on the counter anymore. The life cycle vulnerabilities related to different regions of the country, and the environmental impacts related to climate change. Certainly health policy plays a role here, and there's an opportunity for us to help our students become leaders. Yes, there are deans at the White House table, but there should be nurses, bedside nurses there as well, or at least bedside nurses at their community table discussing the impacts of health of the communities and the patients they care for, which leads to opportunities for leaderships in the courses. There are great research questions that are coming up related to how nurses play a role in this and how can we protect our patient populations, and certainly this has global health implications. Our students are ready for this. They're hearing this from their classmates who are taking economics courses, philosophy, anthropology, engineering, and when they see that nurses have a role in this, it also makes them players within the whole big picture. Next slide, please. So the Alliance of Nurses for Healthy Environments, which is cooperating on this webinar series, has a lot of resources related to climate change and health. There are 2 work groups that meet monthly: the Global Nurses Climate Change Committee and the Education Work Group meet on monthly calls. And so if you're interested specifically in climate change, you can get on the climate change committee call. And the education work group is doing a lot around nursing education for climate change. And so there are, on the website, there's curricular recommendations for each course, the basic courses throughout a nursing program. They are working on concept mapping for programs that are using a concept-based curricula. There's also, we've developed some one-pagers, which are quick one-page references for each course. So there's an adult health one-pager so that faculty member teaching adult health can look and get quick ideas of how to incorporate climate change into their course. We need to develop more of those, so people who are interested, let us know. And we also have climate change related simulations, and we're working on getting climate change into the national licensing exam, and I'll talk about that a little bit more. In addition, ANHE has cooperated with developed a collaborative for climate and health with other nursing organizations, and so nursing organizations have signed on to address climate change within their organization. And then they also have the Nurses Climate Challenge, which is in cooperation with Healthcare Without Harm, and that is for, there's two kind of divisions of that. There's one for nurses where there is training for nurses, and they get materials where nurses can train other nurses. And then there's a new program that's rolling out for schools of nursing. There can be curricular material for schools of nursing to incorporate climate change. So there's many opportunities to be able to bring this to your own school. Next slide, please. It was mentioned about the environmental health textbook. It's Environmental Health in Nursing, which is a free open access textbook, and it did get the AJN Book of the Year. We are working on the second edition of that textbook, and it should roll out this summer. And so we have new material, and most of the authors are nurses. So we've got the expert environmental health nurses, and we have authors from other disciplines as well. Next slide, please. So the other thing that ANHE, or Alliance of Nurses for Healthy Environments Education Work Group, has done is targeted several nursing journals at different kind of types of journals to get this out there to other faculty and nursing deans of why this is important to have it in the curricula. So this article was in Nursing Scholarship of a mandate for environmental climate change into the nursing education. Next slide, please. This is in Nurse Educator, and this is the curricular recommendations, again, through looking at each area, so fundamental, psych nursing, adult health nursing, maternal child health, and how would you incorporate that. Next slide. And this was a publication in Dean's Notes, which is the publication of the National Student Nurses Association. And this spells out why this is important for nursing students to have this education. And so, again, we were targeting a variety of areas of how to share this and why this is important to get it into the curriculum. And there's no escaping climate change. We're all living it. So let's make sure we have nurses who are prepared. Next slide, please. The other thing that the other opportunity that's coming out of this is interprofessional education, and climate change really lends itself very well to that. As Teddy said, we have the Consortium for Climate and Health Education. I also serve on a committee of that organization, and that in that is schools. If your school has not yet signed on, please get them to sign on, but there are schools all around the world that have signed on to promoting environmental climate change into nursing into all curricula. I beg your pardon, because this includes schools of public health, schools of medicine, schools of nursing, and schools of veterinary medicine have now signed on as well. So it's a great resource if you want to do international work of contacting people around the world. And it also provides information of competencies, so climate change education competencies. There's articles there, there's syllabi, there's many resources to support climate change education. The other opportunities for interdisciplinary education is planetary health and the Planetary Health Alliance that Teddy mentioned. This includes over 200 universities and non-governmental organizations, research institutes, and government entities from, again, around the world to address a healthy planet and the impacts on human health. So there's opportunities there. The other one is One Health. And this examines all living things within the ecosystem. So this includes agricultural science, veterinary science, biology, and medicine and nursing. Now, my university does not have a school of medicine or a school of veterinary medicine. We're the only health unit. And so I'm actually using a One Health approach to reach out to biology of how can we collaborate together. So there's again, many different ways to do this. Interprofessional climate curricula is available. University of Minnesota, where Teddy is from, has really an exemplar in this. And so I recommend you look at what they've done. And then if you don't have those resources, you can build your own. And you can create your own interprofessional climate change courses through some of the resources that I talked about. And I'll talk about that a little bit in the next slide. So we need to keep working at this. As you can see, even our accrediting bodies still aren't identifying specifically climate change. And so we have work ahead. Next slide. And one of the ways for us to get into that is through climate-related questions on our exams. Now, when I say this, many other educators say, oh, you're teaching to the test. And I say, yes, I am. And I know that we're not supposed to do that. But the reality is, when we all look at the test blueprints for an NCLEX, or we look at the test blueprints for our clinical specialty exams when we're preparing for that exam. And so since we're looking at the blueprint, we're going to make sure that that information is in the curricula. So one of the things that we are doing through ANHE is trying to get NCLEX for climate-related questions. And it has been a long process, and we continue to work to get there. But we are working on that. But we can also work with our clinical specialty certifying exams and the nurse practitioner exams and assure that our nurse practitioners and clinical specialists are prepared in climate change. And this is one way to do it. So those of you who have contacts, talk to us about that. Next slide, please. Also working through our organizations. So I talked about the Nursing Collaborative and signing on to organizations. But I also said that AACN does not specifically say in its essentials about climate change. And so there are revisioning the essentials. And those of you in the Atlanta area this week, they are having a meeting. There is a registration fee, but if you go to the AACN website, you can see if you can still get to that meeting if you're in the area. But there's also at the AACN website, you can also put comments. So we encourage you to comment if you think that the essentials should include climate change issues. As I said,
Ruth, this is Teddy, and I think this is a wonderful place to perhaps turn it over to Dr. Thompson, who's going to be talking about how to use all this wonderful curriculum knowledge in practice.
Okay, thank you.
Thank you so much.
All right, here we go. Thank you to Sigma and ANHE for inviting me to speak on air pollution, climate change, and cookstoves in Guatemala. Next slide. Today I'm going to talk to you about my research on household air pollution, specifically a description of the scope of the problem, as well as the relationship between household air pollution, ambient air pollution, and climate change. And I'm going to describe two studies that I was involved in. The first was the Respire trial in Guatemala that was conducted almost 2 decades ago, but it really remains the seminal study on household air pollution. And that's because it was the first randomized control trial of a stove intervention, and to date remains the foundation for many studies in the field. And I'll then discuss our current study, the HAPPEN trial, which began in 2017, and it's being conducted in Guatemala, India, Rwanda, and Peru. And this randomized stove intervention trial will end in 2021. So what is the scope of the problem? Air pollution, both indoor and outdoor air pollution, kills 1 out of 8 people globally and is the largest single risk factor. And one of the pollutants, particulate matter, is responsible for 4.6 million premature deaths a year, primarily from acute respiratory infections in children, cardiovascular disease, chronic obstructive pulmonary disease, and lung cancer in adults. Next slide. 40% of the world uses solid fuels such as coal, wood, and crop residue for cooking. And household air pollution from these cooking fires is the 8th leading cause of death globally. Breathing the smoke in the home causes between 1.6 and 4 million deaths a year, depending on who is counting, and I provided the different sources below to show you the range. I took this picture in a house in Guatemala. You can see the 3-stone fire on the lower right and the air pollution monitor in a red basket on the upper left. This kitchen had a mean concentration of 8,600 micrograms per meter cubed of PM2.5, over 300 times higher than the World Health Organization air quality standard of 25 micrograms per meter cubed. And I think if you advance, you might get those numbers on this slide, and you can click to the next slide. So when we used to call household air pollution indoor air pollution, but over the years, we have advanced our knowledge. Really, this household air pollution from burning solid fuels for cooking and heating is a major contributor to ambient or outdoor air pollution because the smoke in these inefficient stoves moves outdoors. In fact, it's been estimated that cooking smoke is actually is a source of 12% of global ambient fine particulate matter, and 500,000 of the almost over 4 million premature annual global deaths from ambient air pollution are really from this mix of household air pollution that escapes into the outdoor air. Next slide. So we discussed the Sustainable Development Goals, and Sustainable Development Goal number 7 calls for access to affordable, reliable, sustainable, and modern energy for all. And one of the aims specifically covers household energy access for cooking and other tasks. I was very glad to see Teddy bring this up in her first talk because it is so important for global health. This is an improvement over the Millennium Development Goals, which did not include modern energy or clean cooking access. Next slide. So we had this slide in one of our earlier talks, but just to illustrate that the smaller the particle, the worse the health outcome. And in household air pollution studies, we typically measure particulate matter 2.5 microns in diameter. And just to give you an idea, you could stack 28 of these particles on the diameter of a human hair. So they're virtually invisible. They are invisible. Next slide. So the Respire trial was a study I worked on between 2002 and 2005 in rural Guatemala. The principal investigator was Kirk Smith, who was my advisor when I was at UC Berkeley. He actually was one of the Nobel laureates to receive the IPCC prize in 2007 for his work on climate change. We enrolled over 500 households in this trial, and if they used a 3-stone fire, pictured on the left, we randomized them to receive a chimney stove, pictured on the right. We followed children for 2 years, and after which time the control group received the chimney stove. This locally produced, well-received chimney stove reduced child exposure by about 50% and reduced pneumonia by 22%, which is clinically but was not statistically significant. So as it turned out, the stove was just not clean enough to improve health, and this article in Lancet describes the study in more detail. But the bottom line is that this chimney stove, which used wood, did not clean the air in the home or outside of the home enough to see reductions and improvements in child health. Next slide. So what is clean enough? This diagram illustrates emissions from different heating stoves in the US, and so but the same principle applies to cooking stoves in lower income countries. So you can see on the far right, the electric stoves or heaters are the cleanest for indoor air, followed by gas, and then the chimney stove on the far left that burns wood is the dirtiest. Unfortunately, in many parts of the world, electric supply is unreliable, leaving gas stoves as the cleanest alternative at present. And hopefully this will change in the future because, as we all know, gas is a fossil fuel. Next slide. So given the results from the Respire trial and other subsequent trials that did not show an effect on health from wood or solid fuel stoves, no matter how clean they combusted, it was never clean enough, the HAPPEN trial was launched in 2017. We did 1 year of formative research from 2016 to 2017. The principal investigators are listed here. I am a co-investigator. I am one of the co-PIs for the Guatemala research site, and I'm actually the only nurse working on the trial as an investigator, although we have many nurses who work in the field on the study. The HAPPEN trial is an 18-month randomized controlled field trial to reduce household air pollution and to look at health benefits across the lifespan. What is the intervention? We're providing liquefied petroleum gas stoves and free fuel. And you can see on the right, somebody carrying a tank into the home. We're providing this to half of the 3,200 households in 4 countries. This provides a schematic of what we're doing. Basically, we have already enrolled 800 pregnant women at less than 20 weeks gestation in 4 countries. And we also enroll older women in the households that reside in the home with a pregnant woman. We're following the children born to these pregnant women until they reach 1 year of age, and the eligibility criteria are listed below. Next slide. The primary outcomes are birth weight, child severe pneumonia, child stunting at 1 year, and adult blood pressure. And we have a wide range of secondary outcomes: fetal growth, preterm birth, child early development, and cardiovascular outcomes in women. This is the picture of the stove that we're providing. It's a locally available, high quality, produced in Guatemala LPG stove with 3 burners. It also has a plate so people can cook their tamales on top of the plate called a plancha. And we provide a continuous supply of LPG fuel delivered to the homes by our field workers so that they won't resume use of the wood if the gas runs out. Because of this new technology, we promote safe and exclusive use, which obviously requires a lot of behavioral change communication. And one of the things that we do in Guatemala is we have the tanks outside of the home, not inside of the home, for safety. At the end of the trial, control homes can either choose to receive a gas stove or other household goods according to their needs. We're measuring particulate matter, PM 2.5, and carbon monoxide. These are personal 24-hour measures worn by women in our study. We're also measuring black carbon in the kitchen. We measure 3 times during pregnancy. We also measure the infant 3 times, and then the older adult woman 6 times. Next slide. So what is the behavioral change kind of theory that we're using? We're actually using Susan Mickey's COM-B model. It's a behavioral system that provides a foundation for evaluating capabilities, motivations, and opportunities that allows us to make a behavioral diagnosis to develop an intervention. And we did this during our first year of formative research. Next slide. So I just want to go through 3 little slides here to illustrate how this works. This first slide illustrates addressing capabilities. So during our formative research, we heard that safe gas use was an area of concern. And in focus groups, we heard about explosions, that women would cover the tank with old rags, something we observed, thinking that that would prevent a carbon monoxide leak. So to address capabilities, we developed messages, including a calendar that was locally developed to give to the intervention homes to describe what the family should do if they detect a leak. Next slide. Another thing we heard a lot about was cooking traditional foods. People said that foods taste better on wood stoves, and so we addressed this behavior through opportunities. We conducted cooking demonstrations. We created videos that we shared with the households when we observed wood stove use. Next slide. Finally, motivation is one of the biggest factors in changing behavior. And we held focus group with men who participate in decision making around cook stoves. In our focus groups, they talked about forestation, climate change, family health. And to address these motivations, we created a calendar image that shows the difference between deforestation and air pollution from wood fuel use in the top panel versus homes using gas stoves in the bottom panel. While this may seem graphically simplistic, these images were created from words of participants in the focus groups. Next slide. How do we know that people in the HAPPEN trial use their wood or gas stove? Well, we have temperature probes that we place on the stoves, and we use an algorithm to determine sustained temperature increases flagged as stove use events. And then our field team visits the households to provide reinforcement messages. I've only presented our work in Guatemala, but we have teams similar to this team in Rwanda, India, and Peru, and we all use a common protocol. We've completed recruitment of 3,200 pregnant women, in fact, last week, and we expect to disenroll the last child in June 2021. This is a picture of our team of Guatemalan staff, and including 20 nurses. We have a very enthusiastic team, who are highly skilled and dedicated, and it's just such an honor to work with them. And I look forward to presenting our results in the future. And I have one final slide. I just wanted to make this point so that, you know, the connection between climate change and household air pollution. If we were to convert 1.6 billion people who cook with firewood to LPG, emissions would be on the order of 0.2 billion tons of CO2 per year. You can compare that to the transport sector with over 7.5 billion tons, or commercial aircraft at about 0.8 billion tons. So although we may be concerned about, you know, using fossil fuels to replace wood fuels, in fact, it's orders of magnitude less than what we use in the developed world, and we think will really impact the health of people who are breathing in this smoke in their homes. Next slide. I just want to thank all of our collaborators on the trial. And then on the next slide, I've provided some resources for you to review. In case these slides are shared, it's very busy. And then my final slide is just to say thank you.
Thank you so much for that wonderful talk. And now we'll move to Dr. Rodriguez, please.
Good afternoon, everyone. My name is Dorian Camacho. I'm the Dean of the Nursing Faculty in the Cooperative University of Colombia in Santa Marta. Also, I serve as Vice President of the Board of Directors of the Colombian Association of Nursing Faculties, and I'm member of Sigma Theta Tau Chapter Upsilon Nu and ANHE. Next, please. Let's begin with the agenda for my presentation. 1. Nursing guidelines in Colombia. 2nd, experience in education. There, my work with ANHE. Next, please. In 2019, the National Health Institute published the Environmental Border Report in Colombia, which showed that 70,549 deaths are associated with environmental risk factors. According to the findings, there are 9 diseases in our country that are associated with environmental risk factors, 7 of them with the possibility of death. Ischemic heart disease, stroke, obstructive pulmonary disease, acute respiratory infections, and cataracts are attributed to poor air quality. Diarrheal disease is mainly attributed to poor water quality. Mental disability is associated with radon, and chronic lead kidney disease with lead contamination. Next, please. In Colombia, nurses are committed to work on risk prevention and mitigation. The Nursing Code of Ethics calls us to take care of the environment by avoiding the use and promotion of products that may negatively affect it. Next, please. The current comprehensive healthcare model provides us with the tools from nursing professionals to work in this area. It establishes specific actions to educate us in environmental care practices with relation to air pollutants, conservation of natural resources, rational energy consumption, waste management, promotion of responsible consumption practices, and caring for our public spaces. Next, please. Educational activities involving the maintenance and safety of the environment are established to provide knowledge on chemical substances in the home, water treatment and care inside the home, accident prevention in public spaces, prevention and mitigation strategies against emergencies and disasters, adaptation to climate change, improving air quality conditions inside closed spaces where people live, and preventive control measures for zoonosis and vectors. Next, please. Let's talk about environmental nursing in education. Next, please. There are several universities that are promoting environmental health education. The popular University of Cesar is working on a social project called eco-nursing, with the aim of taking care of life and the environment. They have achieved the inclusion of environmental protection in the core plans, the development of projects in the classroom, interdisciplinary research projects, and participation from the community. Next, please. The University of the Andean area focuses on teaching social projections and research in the area of environmental health through social projects and a specific line of research in environmental healthcare. Next, please. The University of Caldas guides a course on ecology with attention to the environment, where environmental problems are their relationships with the disease health process are analyzed. Next, please. The University of Santander has the Green UDES project, through which the Green University is promoted by formation of environmental guidelines, ecological days, recycling campaigns, and tree planting. Next, please. The University of Valle held an environmental nursing symposium last year and signed an environmental commitment with the participation of teachers and students. Next, please. Finally, in the Cooperative University of Colombia, we include a specialized course on environmental nursing in our curriculum. In research, we carry out tests on environmental health in theories in nursing. In social projection, we are working on the identification of environmental risk factors in the region by examining evidence which shows the impact of these factors on the health situation. Next, please. Let's discuss my collaborative work with ANHE, which I have been associated for 6 years. Next, please. As part of the Nursing Climate Challenge, I have been able to work with 2 nursing associations. The Colombian Association of Nursing Faculties, which brings together 49 nursing schools in the country, and with the Colombian Association of Nursing Students, who organized last year's Congress on Nursing and Environmental Panel. Next, please. I have also had the opportunity to educate students and nursing professors through participation in academic events and video conference. You have here some examples from this kind of events here in Colombia. Next, please. Thankfully, I have had the opportunity to promote the cause of environmental health to other countries by involving other nursing professionals in the discussion about climate change and its effects on the health of our communities. Here you can see some examples from the work with Mexico, Netherlands, and Spain. Next, please. Research is one of my main focuses, and I currently have 3 articles published in this thematic line. I have had the opportunity to participate in the publication of the Environmental Health in Nursing its book, 2nd edition, by ANHE. Next, please. As a result of my doctoral thesis, I propose to you the model of the promotion of children's environmental health, in which I discuss the training of environmental nurses capable simultaneously caring for the environment and promoting children's environmental health with the support of families and local communities. Next, please. What's next? In Colombia, the number of professionals working in the area of environmental nursing is still small. But every day we are getting more allies and we are actively striving for a ANHE working group for all of Latin America. Thanks for hearing me.
Thank you to our wonderful presentation as presenters. This has just been just great. Dr. Levy, we have several questions from people requesting the link to the free book. If you could place that in the chat space so people have that link, that would be beneficial. And one comment I have for Dr. Rodriguez is you just do have such a beautiful exemplar of environment and climate change threaded through your entire program, your practice, your research, and your education. And it's just a wonderful exemplar for the rest of the globe. One of the questions that came through for you, Dr. Thompson, is about our the use of clean fuel. We understand, it says, I understand why the LPG stoves are better in the short term due to air quality and health. However, we'll need to be moving away from fossil fuels. Are there any researchers looking at the stoves that do not burn fossil fuels? Are there any options to have cleaner stoves? So I'll turn that over to you.
Yes, I mean, definitely what people are looking at in the field right now is that this is a transitional fuel and that this is really the kind of the study that should say, okay, by reducing particulate matter by X, we see this improvement in health, and therefore we can move on policy that might look at other cleaner sources. So in some countries like Ecuador, they're using electric stoves fueled by hydroelectricity. So there are examples of that, but in some other places, perhaps electric stoves are from coal, coal use. So it's hard to figure out what would be the cleanest cooking fuel for the majority of the world that breathes the smoke. At this point, it seems to be this LPG, but hopefully in the future we'll have new technologies or new sources of fuel that will be renewable and not related to fossil fuel.
That's wonderful. Thank you so much. And Dr. Levy, one of the questions we are asked in our chat space, but also by a lot of students today, is they would love to be involved in environmental nursing jobs. Could you perhaps share with the audience options for graduating students of where they might practice? And she might be muted. In the meantime, while if she's able to come on, she did put into.
Okay. Sorry about that. No problem. Sorry, I was muted. Yes. Okay. So for new graduates, what I always recommend is that they try to get onto their health systems green teams and work within sustainable practices of the health system, and then that gives them some opportunities to move forward into a full-time job. And there are many nurses that work in like a hospital sustainability director or in that capacity. So that's a good starting point.
That's great. Thank you so much. And I'm going to have Kara perhaps wrap up with the last question, and that is, how can people get these slides? And are there some next steps that you would like to pass through related to initiatives through ANHE?
Yes, hi everyone. Kara Cook here with the Alliance of Nurses for Healthy Environment. So this is the third webinar in this series that ANHE and Sigma have done together, and these are all going to be posted on the Sigma repository. The first two should be up there, and then this one will be posted within 10 days. So you'll be able to access the recordings. There's been quite a bit of interest in sharing these recordings, nursing faculty sharing these with students in their classes, so you're welcome to use these through whatever networks that you have. So please share widely, as we've just been so thrilled to organize these webinars, and just thank you so much to the speakers who participated today.
This concludes our webinar for today, and thank you to our attendees for joining us. Have a wonderful evening.